Hello and welcome to our lab. This is where a lot of the work has taken place on the project that I'd like to present to you today. Let me tell you the story of my friend Tara Wink. Tara was 27 years old when she was diagnosed with oropharyngeal cancer. Tara didn't drink. Tara didn't smoke. In fact, Tara was a beautiful young lady who did everything right. But within 3 months of her diagnosis, Tara was no longer with us. And Tara is one of the reasons why we have embarked on this project. Oral and oropharyngeal cancer is the 6th most common cancer globally. About 2,200,000 people live with oral and oropharyngeal cancer at any one time. Oral and oropharyngeal cancer is typically a disease of the underserved, of people who live in remote locations, of individuals who do not have access to health care for logistical or financial reasons. And yet, at the moment, we diagnose oral and oropharyngeal cancer in specialist offices by taking surgical biopsies. That punch biopsy goes off to a very specialized, very expensive lab. This process works okay in areas where you have direct specialist access, but it does not work at all for the 90% of people with oral and oropharyngeal cancer who do not have access. What we do right now is we screen for oral cancer risk using visual exam. You visually inspect the oral cavity, you palpate the lymph nodes, and you ask your patient about high-risk behaviors. How accurate is this process? Well, you might as well toss a coin. Screening accuracy is 30 to 60%. That is why we are here. We have developed a very low-cost, very robust, simple-to-use tool for diagnosing oral cancer early that a community-level worker can use. Oral and oropharyngeal cancer that is related to HPV typically sits in the lymphatic tissue in your tonsils or in the lymphatic tissue at the base of your tongue. Well, you can open your mouth as wide as you want. No one is going to be able to see the little changes in color and texture that might indicate there's an oral cancer there. This device here is sufficiently thin and bendy and has a very, very versatile autofocus so that we can image at high resolution all the way back to the tonsils, the soft palate, the base of the tongue, where the high-risk areas are. It takes photographs at different wavelengths of light of the different areas of the mouth and then runs these photographs through an artificial intelligence algorithm. The device syncs wirelessly with any kind of a smartphone. We have focused on maximizing the impact of our project by ensuring that the scanner that we have created for screening and diagnosing for oral and oropharyngeal cancer is well suited to the environments where it will be used. You don't need a specialist, you don't need a lab, you don't need a pathologist. The components within this device only cost a few dollars. We've tested it most extensively in India. In some parts of India, oral and oropharyngeal cancer is the #1 cause of mortality. Together with our colleagues in India, we go to remote villages and we screen the entire village in 2 or 3 days. In one area where we screened about 10,000 patients, our system was twice as accurate as existing diagnostic modalities, and we diagnosed almost 800 cancers that had remained undiagnosed in that population of 10,000 people using conventional exam. Our diagnostic accuracy is about 86%. That's really good for a non-invasive tool.